Pregnancy is also one of the factors that could predispose a patient to candidiasis specifically. Pregnancy seen like um, something away from the normal physiological function of the system, something like in quotes, pathology in quotes. So it predisposes them to having that, and some use of oral contraceptive to also set imbalance in this vaginal area. And again, bacterial vaginosis, just like we've discussed before, it's also is also not a toilet infection. It's not picked from the toilet, and in fact, there have been arguments that these organisms actually don't exist outside the human body. So, for every time they need a human vector, they need to be transferred from a human to another human, and it doesn't shows you're wayward. It doesn't shows you've had issues. Even an immunocompromised state will just predispose you to having it. So that means if your immune system is low at any point in time, just like the way your immune system is low and you get to have malaria, your vaginal candidiasis can also set in, and maybe bacterial vaginosis can also set in. But for trichomoniasis, of course, which is caused by Trichomonas vaginalis, this is a sexually transmitted infection. Now, whether it is a multiple partner that predispose one to it, or a fresh partner that you're having sex with that predispose you to it, the bottom line is the fact that it is an STI and must be treated as such. So in taking care of this, some of my respondents have actually express some feelings about the management strategy, which we are trying to prevent you from reinfection, and we said you should treat your partner as well. So if you don't want to treat your partner and then you still want to treat yourself, it means at some point you will still be reinfected again, and we have to start all over again. And by that, we might even be breeding resistant to the microorganisms, to the antibacterials that are being used